Shirley?
I just hit record.
You did? Okay. So then we'll get started. Okay. Um, Welcome, everyone. Thank you for joining us. I'm Renee Fuzzy Moore. I'm the director of the Health Services Center, and I'm joined here today by our full staff who will join in occasionally and we'll introduce ourselves at the end. So we're here today to talk about health and race in the COVID-19 pandemic. So our objective today is to highlight the effects of COVID-19 and the health of people of color. We have three goals today. We're going to examine the research and analysis of the facts relating to the impact on various races. We're going to review risk factors and identify healthy life choices that can help to reduce health problems. And we're going to consider some options for creating a personal health plan. So just to begin, we're going to begin with a little brief definition of things. So just to know what's the difference between an epidemic and a pandemic. An epidemic, which is an outbreak is called an epidemic when there's a sudden increase in cases in a certain area. And a pandemic is when an epidemic occurs worldwide or over a wide area, very wide area, crossing international boundaries and usually affecting a large number of people. COVID-19 was declared a pandemic in March of 2020 by the World Health Organization. And as you recall, that is when CUNY and LaGuardia shut down and we went totally remote. So we've been in this remote virtual world for about 10 months now. And I'm sure somebody may be wondering, so how did this pandemic end? And the most desirable option would be to have a vaccine or the development of effective treatments. And as you hear on the news, we have now had an approved vaccine here in the United States. It's moving along. There was just an announcement by the mayor and the governor that New York will start vaccinating people, I think, by Monday. So that's something that I guess we can look forward to. That would be part of ending the pandemic. We'll talk about a little more about that later. So the COVID-19 is caused by a coronavirus called SARS-CoV-2. And the coronavirus is a large family of viruses transmitted between animals and people that causes respiratory illnesses. SARS stands for Severe Acute Respiratory Syndrome. COVID-19 spreads mainly from person to person and mainly through respiratory droplets produced when an affected person sneezes, coughs, talks, sings, or breathes near another person. And the effects of COVID-19 affects different people in different ways, ranging from mild symptoms to a very serious illness. I want to draw your attention to the right-hand side of the page where there is a YouTube picture of a coronavirus lecture. And you can find this lecture on the LaGuardia main webpage. You would click on the box that says Fall 20 and Spring 21 information, and then scroll down till you come to this picture and click on that. I really encourage you to do it. It's maybe about 15 or 20 minutes, but it's very detailed and you'll have a very clear understanding of what the coronavirus is. It's done by one of our professors in the, okay, I forgot exactly where she's from, but it's done by one of our professors here at LaGuardia. Okay. So who is most at risk for COVID-19? So we learned that all ages can be affected by the virus. People who are 70 years older and older are at an increased risk for severe illnesses, and those with pre-existing medical conditions appear to be more vulnerable to becoming severely ill. And some of those pre-existing conditions could be asthma, diabetes, health disease, and lung disease. There are others, but these are a few. Okay. I kind of think, okay, I'm going to jump a little bit because my slides got a little mixed up here. So just before we go any further, I just wanted to also point out, what are the symptoms of the virus and some ways we can prevent and stop the spread. So we definitely want to know what the symptoms are. And symptoms may appear 2 to 4 days after exposure, and they may include fever or chills, a cough, shortness of breath, difficult breathing, fatigue, muscle or body aches, headache, loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. And ways we can help stop this spread is to follow these few tips. We want to avoid contact with sick people. And if you're sick, please stay home. If you need to cough or sneeze, use your elbow. Continue to wash your hands often. Wear a face mask when you're outside. Avoid touching your face. Disinfect frequently surfaces that you touch frequently. I think that's a little mixed up there, sorry. And also to practice social distancing. So, okay. So at this time, we're going to, before we move on, we're going to take a quick poll. So we're going to have Luz Royal, our assistant director, pull up this poll. So as you see, there's 3 questions on there. If you can answer your choice to these 3 questions. Okay. Does it seem we...
People are answering.
Yes. Almost there. Okay, I think we're good. You can end the poll, Luce. And here are our results.
So for those people who would consider wearing a mask outdoors, out of 7 people, 6 people said yes. Do we support a secondary mandatory shutdown? It looks like everyone is supporting that. And will you be open to receiving the vaccine when available? We have 5 that would say yes and 1 that would say no. I'm kind of curious as to why they would say no.
If you would like to share that in the chat room, that would be great. And if you said yes, why do you feel, comfortable saying yes to taking the vaccine? We'd love to have that information in the chat room. Okay, so we can stop that poll. Okay. So, let's Sorry, folks, things are getting a little mixed up. Okay, this is where we stopped at. We started here. So looking at how COVID is affecting different races, we looked at some research. One was done by the American Public Media Research Lab, and they have a project called The Color of Coronavirus. And you see on the left-hand side, of the more than 240,000 deaths in the United States, and you break it down by race, you can see the disparity that's there. You'll see that among Black and Latinos are over 46,000. Other races are lower. And if you move this information over to the right-hand side of the charts, to give you a better perspective of it, you'll see where white Americans make up about 60% of the population, but their deaths per 100,000 is about 61 Americans. As far as Hispanic and Latinos, which represent about 18.5 of the US population, their deaths per 100 is about 78.5. Black Americans count for 13.4%, and out of 100,000 deaths, they account for about 114 people. Asian Americans accounting for 5.9% of the population is accounting for about 47.6 deaths. Races where there are two or more, which represents 2.8% of the population, I didn't have that information there per 100 deaths, but you will see some information like that on the next slide. Native Americans, which represent 1.3% of the population, and you see their rate is about 108 people per of Native Americans. And you see that's pretty similar to African Americans. And you see that disparity with African Americans being 13.4% and Native Americans only representing 1.3%, but they're dying at a rate just as high as Black Americans. So on this next chart, you get to see just laid out a little bit. This, I should have mentioned the information that I showed before was effective as of November 10th. This information is just a little bit more updated, so the numbers are a little higher, and it shows the difference in how many Black Americans compared to the other
I
races.
was thinking birthday
And
cruise
even-
at 4 o'clock, and maybe we can go tomorrow.
I'm sorry, somebody talk? Oh. So why are certain populations more affected than others? Well, we know health differences are often due to economic and social conditions. Access to healthcare is another factor. Limited to access to healthy foods, which can lead to obesity and other concerns. And then there's language and immigration status that may have an effect. So if you look on the right-hand side and we talk about some of the risk factors that we mentioned earlier, and we look at it by race, and these are the top three racial categories that had high death rates, and you can see some similarities. You see that diabetes and obesity is in all the categories, but then each category has their own special concerns: heart disease and high blood pressure among African Americans, liver disease and chronic respiratory disease, chronic lower respiratory disease in Native Americans, and in Latinos, asthma and liver disease is one of the risk factors affecting COVID-19. And knowing this information can help you develop a personal health plan that we're going to talk about in a few minutes. So this is what we put together as a personal health plan. And it's talking about health through the ages. So there's different things you can do as you age. Many of our students here are about 20 something, so that's where we started at. And overall, you want to assess your health, you want to assess your risk factors, you want to continuously expand your knowledge. And one of the big factors is you need to establish and maintain access to health care. So if we looked at the 20 something, what you want to start doing, and you want to keep what you started here in the 20s, you want to keep it going through your 30s, your 40s, your 50s, until you and continuing on through 60 and above. So at first you want to just establish some baseline numbers. You want to know your blood pressure, your glucose, your cholesterol, your weight. You want to check your HIV status. You want to check your mental wellness, and you want to create an exercise plan. So now you have that base. And as you move to your 30s, you want to continue all these things you just set up, because they will change from as you age. But then you want to start thinking about some other things like consider hereditary risk screenings. And these are disease determined by genetic factors, which are able to pass from parents to their children. And so, for instance, if a parent was diagnosed with cancer, say for example, at and I'm just a random number at age 50, the children of that parent would want to start considering their health risk 10 years before. So at your age of 40, you want to start talking to the medical professions and sharing your family history to see what you need to be checking on. Many times we know certain cancers, if they're caught very early, can be cured. So you want to make sure if anything happens that you have looked at it as soon as it could possibly come up. And that will definitely come up in annual checkups. So you want to start making sure you have annual checkups. And as you get into the 30s, you want to start updating your physical activities. You can start to gain weight as you age, and it can be very harder to lose weight once you age. So when you're 30 something, you want to keep track of that. And when you turn into your 40s, again, some of the things you want to start thinking about is updating your vision. You want to stay on top of your dental health. Of course, you started this when you were 20 something as well. And just to go back just quickly on the 20 something regarding vision, you want to make sure vision wellness is part of your overall health plan. We're at a time where we're on computers and tablets and our phones, for long periods of time, and that can really have an effect on your eye health. The blue light there can really place serious, create serious problems. And you may want to consider some options such as blue light blocker glasses or screens for your computer. So again, getting back down to the 40 something, this is a time when medical professionals recommend certain screenings. And for women, it's they recommend mammograms to detect breast cancer. And although mammograms are for women, we definitely want you to know that breast cancer is something that men can get as well, and that they should pay attention to certain signs that they should point out to their health professional. Again, you want to sort of update your dietary choices, start trying some different things. If you were a big candy eater, maybe you want to cut down on that at this time. Moving over to your 50s, again, there's some screenings that medical profession recommends. So getting your colonoscopy, having prostate screenings. So staying up on those screenings. And once you turn 60, your bone density is something that you really want to consider. And if you're at that point where you may have developed some kind of health concern and now you're on medication, you want to make sure you're maintaining the health care that you need. And all of these age times are when your, excuse me, your health care is going to be extremely important. So you want to make sure you maintain health care throughout the time.
Yeah, I just want to chime in real quick and just acknowledge that again, because most times most people pass off getting older with, oh, some getting older aches and pains. And sometimes that's a warning sign that we often ignore. You know, most people, especially men, don't really go and get checked out until something is apparently wrong. And by that point, you've already are at the point where you can't change it, you know. Women too. So I just, that's my little soapbox moment.
Thank you, Kevin. Appreciate that. So, you know, we talked about that little health plan that we just went over, but just here are some things that, you know, we're in this the shutdown. We're all getting, shutdown fatigue, and I just wanted to point out a few little things that could help you feel better during this time. So one of the things you want to do is get outside. The sunshine, the fresh air can really boost your mood. Um, and if you can find some green space, that'll be great. You still want to continue to be safe and wear a mask and keep your social distance. Another thing you want to do is to be active throughout the day. Plan for short breaks. If you're sitting at a computer all day, take some time every hour or so, make sure you're standing up, do a little stretching. And then connecting to your eye health, there's this 20-20 rule. So like every 20 minutes, if you could just turn your eyes away from your computer and look about 20 feet away just to clear your vision and then come back to the computer, can be a very helpful thing to do. Okay. You want to, something else to help you make you feel better is sort of, sometimes you got to limit the social media and the news. There's so much news going on. There's the election that's going on forever. There's misinformation, and you can really get on information overload. So you want to just limit that to help you feel better. You want to also take some time to relax. Create a visual rather to help you wind down. Listen to music, scented candles, turn off your phone, just some time to help you relax. Okay, next thing to help you is to give and receive help. Don't be afraid to ask for help if you need help. There are so many community outreach activities. 311 is always full of information, and help is out there. So reach out if you need help. And then also trying to help others, looking on your neighbors. When you help others, it can help you feel better as well. Another thing you could do is try something new. I mean, you have this newfound time. Try to explore a new interest. There are tons and tons of online videos and websites that you can go and learn to do things that you never had time to do, but you had a slight interest. Check them out now. Research has showed that hobbies are very good for your health. So check out some things there and try something new. The next thing you want to do is you want to try to go easy on yourself. You're not always doing all the things you used to do, but focus on what's most important. And at the number one thing on that list should be keeping you and your family safe. One thing you can also do is start a journal. Consider a gratitude journal. Instead of focusing on what you can't do and being sad about that, focus on what is going well. And that can really also lift your mood. One of the things you want to do is watch for unhealthy patterns. Look at any changes in your habits. Are you drinking more? Did you at one point stop smoking and now you're smoking again? Are you, how's your mood? Are you having angry outbursts? Try to tune into that so that you can see that some changes are happening and you can make some adaptations to help clear them up. And last thing I want to just mention is to think about the big picture. You know, even though you may live alone, you may not have a lot of family around you, you just need to really remember that you're not alone. People all over the world are going through the same thing that you're going through. So we just want to remind everybody that we're all in this together. Any comments? So what we also want you to know is that at the health services, we have created a health services at home series so that on a weekly basis, you can tune into our wellness series and get some great information and tools on things that will help you stay healthy. We're starting them off in January. January 13th is the very first one, and we'll be showing information about staying active at home. The next one will be staying hydrated, so you can learn the power of water that is so necessary for your body. On January 27th, we're going to be talking about eating for good health. And on February 3rd, we'll talk about the power of sleep. Again, that's so connected like with the power of water that really helps you function well. And then we also always want you to be mindful of your mental wellness, and we'll be talking about that on February 10th. We'll be posting this information on our web pages, and we hope you look out for them and plan to attend. So that concludes our presentation, and on behalf of the Health Center staff, I really want to thank you for joining us today. As I mentioned, I'm Renee Fuzzy-Mortar, Director of the Health Services Center. We were joined also by Luz Royal, our Assistant Director and our Senior EMT Paramedic. We had on the line Nurse Pat Jimenez, who's the college nurse. We had Kevin Tenario, who's also a EMT Paramedic, excuse me, and Shirley Solis, our Immunization Coordinator. And we also had our graduate intern, Hassa Tahir. Listed down here on this page, you see our health services, the ways to connect to us, and that information would also be in the chat box. So I'm just going to ask, is there anything in the chat box that that people might have been inquiring about?
Well, I would just like to jump in real quick, and I was the one who would not be taking the vaccine.
Okay,
And that
great.
is, yeah, that's just something that I think everyone is just looking for a relief, which is great, and it would be awesome. But I'm in that population that has adverse reactions to vaccinations. So for
Okay.
me, until we see what the overall result is, with anything you want to do research. And so from what I understand, there have been some reactions or allergic reactions or adverse reactions that certain individuals have received it. So me personally, where I can't even take the flu vaccine, this kind of would fall into that category for myself.
That's great. And thank you for sharing that, because that is one of the things that people, should consider. What are your risk factors? So thank you for sharing that. So with that, I would like to end the presentation, and hope this was very helpful to you. And we look forward to seeing you at our programs at the Health Services Center. Okay, thank you.